Good evening, everyone. My name is Horace Turner.
Good evening, everyone. My name is Lady Milla Bernasconi.
We're trustees of the CCPU Healthcare Fund, and we are early educators and childcare providers just like you. We would like to welcome you to the CCPU Healthcare webinar tonight about the free healthcare benefits available for you through your union, CCPU. We're excited to see all of you here tonight because we're going to go over important information about why is it easier to ever enroll in the healthcare fund. And now you can do it too.
Okay. I want to share two important reminders before we get into the agenda for tonight. Number one, we are proud to offer free healthcare benefits to all our eligible CCPU providers. And number two, the CCPU Healthcare Fund does not request or collect any information about people's authorization or immigration status. During today's presentation, we will be describing the CCPU Healthcare Fund's benefits for providers and your families. The purpose of this presentation is to provide you with an overview of the benefits we offer, how they work, what they cover, who is eligible, and how to apply. There will be time for questions at the end of the presentation. However, we will not be able to answer specific questions about individual cases. If you have any questions about your account, we ask that you please contact us for support, and we will not be able to address personal situations in tonight's webinar. Here is the agenda for tonight. We will provide a brief update from the union, and then we will cover some general information for our healthcare fund. Next, we will talk about why enrolling is easier than ever. After that, we will talk about the different benefits in the program and how to apply. Finally, we will end with questions and answers. Now, let me pass you to our sister, Anna.
Good evening, everyone. Hola a todas. Mi nombre es Ana Ballesteros. Soy proveedora del condado de Kern por 10 años y orgullosa miembro de CCPU. Estoy aquí para hablarles acerca de nuestra unión de proveedores de cuidado infantil. Me emociona compartir con ustedes información sobre nuestra unión. Siguiente, por favor. Okay. He sido miembro de la Unión durante 9 años y han sucedido muchas cosas en esos 9 años. Tengo que decirles que si no fuera por CCPU, probablemente no siguiera siendo proveedora de cuidado infantil el día de hoy. Soy también parte del equipo de CAT para ayudar a nuestro equipo de negociación a compartir información y ayudar a hacer crecer nuestro sindicato. Estoy segura de que han notado el código QR o QR en este dispositivo. Si aún no es miembro, puede escanear el código QR en la pantalla para acceder a nuestra solicitud de membresía. Ahora puede hacerlo. Le daré un minuto para que trate de inscribirse y haga todo lo posible de hacerse miembro. Voy a continuar mientras usted sigue haciendo la solicitud. Les seguiré hablando de más información. La siguiente slide, por favor. ¿Qué es nuestra unión? Una unión está formada por proveedores que se unen para lograr mejoras en su profesión y en sus comunidades. Y eso es exactamente lo que están haciendo los proveedores. Con nuestra unión ahora tenemos un asiento en la mesa donde podemos dar nuestra opinión, nuestras sugerencias sobre cómo hacer que el sistema funcione para todos los proveedores, los niños y las familias. El Estado y las agencias con las que contratamos ya no pueden tomar decisiones unilaterales que afecten a nuestro trabajo y a nuestro sustento. Ahora tenemos derechos de negociación colectivamente. Siguiente, por favor. Y me enorgullece compartir que nuestra unión de proveedores de cuidado infantil incluye más de 60,000 educadores de la primera infancia en California se juntan en nuestra unión, Child Care Providers. Pertenecen tanto a nuestras respectivas uniones locales SEIU local 521, SEIU local 99 y UDW, como a CCPU para poder hacer cambios a nivel local y estatal. Actuamos colectivamente para mejorar la calidad y la asequibilidad del cuidado infantil, así como la paga y los beneficios de todos los educadores de la primera infancia. Estamos comprometidos con el cuidado infantil para todos de diferentes orígenes, que hablen diferentes idiomas en todos los condados y todos los tipos de licencia. Siguiente, por favor. Unidos somos más fuertes. Observa esta imagen. ¿Qué ven? ¿Qué te viene a la mente cuando ves esto? Lo puede poner en el chat. El pez pequeño nos representa a nosotros, los proveedores de servicio de cuidado infantil. Sin una unión, estamos solos. Somos un pez pequeño que tiene que resolver problemas con las agencias, el Estado u otros problemas que podamos tener. Pero si todos nos unimos en nuestra unión, formamos algo más grande. Estamos unidos y podemos actuar colectivamente para alcanzar una meta común. Juntos somos más fuertes. La siguiente, por favor. El poder de nuestra unión nos ha hecho ganar. Lo que hemos ganado hasta ahora, aumentos salariales y una vía para conectar los reembolsos con los costos reales del cuidado de los proveedores. Los beneficios para estabilizar proporcionan reembolsos de la atención médica, dental y visión, fondos de jubilación y entrenamiento y desarrollo profesional, mejoras al sistema estatal de cuidado infantil, pago por inscripción, no por asistencia, menos horas para calificar para cuidado a tiempo completo y protección contra el COVID. La siguiente, por favor. ¿Cómo seguimos? ¿Cómo seguimos? Ganamos. Bueno, el futuro de nuestra unión, nuestras carreras y nuestro sustento depende de todos nosotros, aumentando el número de miembros, reclutando líderes, asegurando que tenemos los recursos y el poder para seguir ganando. Juntos podemos asegurar que los proveedores dedicados tengan los mismos beneficios y protecciones básicas que otros trabajadores esenciales. Seguimos construyendo nuestra unión para hacernos más fuertes y seguir lo que necesitan los proveedores y familias. Siguiente, por favor. Ok. Y el primer paso para ganar es asegurarnos de que todos los proveedores se inscriban como miembros de nuestra unión. Asegurémonos de completar la solicitud en línea. Paso para ganar es asegurarnos de que todos los proveedores se inscriban como miembros de nuestra unión. Por favor, haga clic en el código QR que aparece en su pantalla y puede completar para hacerse miembro. Siguiente, por favor. Para quienes ya son miembros, también estamos contando con ustedes. Necesitamos que te registres en el equipo de CAT para llamar a otros proveedores para compartir actualizaciones, reclutar nuevos proveedores para que se unan, organicen una reunión e inviten otros proveedores que sepan que no son miembros a unirse. Necesitamos su voz, compromiso para mantenernos en marcha y para mantenernos fuertes. Compartan en el chat cómo puede ayudar a hacer crecer nuestro sindicato. Por favor, si lo pueden escribir y así nos dan ideas. Nuestra unión es como un gimnasio. Solo veremos resultados si estamos activos. Puedes compartir en el chat cómo puedes participar. Siguiente, perdón. Sí, siguiente. Sí, perfecto, gracias. Quiero compartir nuestra visión. Somos CCPU, CCPU, así que cuando digo nuestra visión, no es la visión de un individuo, sino nuestra visión de sindicato de proveedores. Nosotros juntos formamos el sindicato y nuestra visión. Necesitamos que todos los niños tengan acceso a un cuidado infantil de calidad y para nosotros los proveedores que nos aseguremos de ser respetados y tener un trabajo de calidad, salarios dignos, beneficios y oportunidades de capacitación. Siguiente, por favor. Dejemos saber en el chat si está listo para asumir el papel de CAT. Y uno de nuestros organizadores se comunicará con usted también para comparta y comparta, por favor, de qué condado nos estás acompañando. El equipo de acción de contrato de CAT, por sus siglas en inglés, es un grupo dedicado de miembros líderes que se encuentran en el centro para aprovechar nuestro poder colectivo durante las negociaciones. Los miembros de CAT se comunican regularmente con otros proveedores en su área sobre el progreso de las negociaciones GLMC cuando si el Estado se está demorando en la mesa de negociaciones, el equipo de acción de contrato nos llevará a tomar acciones para demostrar nuestra fuerza unificada como sindicato y ejercer presión sobre el Estado para que obtengamos lo que merecemos. La siguiente, por favor. Este es parte de nuestro maravilloso equipo de negociaciones, quienes han dedicado todo su tiempo, todos sus esfuerzos y gracias a ellos conseguimos este contrato. La siguiente, por favor. Estos son los aspectos destacados del nuevo contrato. Se ganó 37,000 millones anuales en ajuste por costo de vida, entre comillas COLA. 90 millones en pagos únicos de estabilización. 80 millones anuales en fondos de jubilación, 100 mil millones anuales en fondos de atención médica, 15 millones anuales en fondos de capacitación y educación continua, posibilidad de renegociar aumentos de tarifas si la legislatura asigna más fondos en presupuestos futuros. Avance significativo en la reforma tarifaria y compromiso de avanzar hacia un sistema de pago prospectivo, pago continuo por inscripción. La siguiente, por favor. Y finalmente, puede mantenerse conectado siguiéndonos en nuestras páginas de redes sociales en Facebook, Instagram, @CCPU California o en nuestro sitio web en childcareprovidersunited.org. Y pues nada más agradecerles mucho por su atención y no dejen de hacerse miembros. Entre más miembros seamos, más fuertes seremos y menos nos vencerán. Por favor, únanse ahora. Y le paso el micrófono al del Fondo de Salud. Gracias.
Thank you, Anna. Man, what great information. I love my union. And
I
just like
love it.
Anna said, the stronger we are, the larger we are, the stronger we are. So, yes, just like Anna said, get active, become active, and join. So, great information, Anna. Thank you for your time. I'd like to now introduce you to the Healthcare Fund, leaders of our Board of Trustees. Go to the next page. Thank you. So, the CCPU Healthcare Fund is a healthcare trust governed by a Board of Trustees. The trustees are appointed by SEIU Local 521, SEIU Local 99, and the United Domestic Worker ASME Local 3930. The members of the board are a combination of providers, that's Lady and I, and the staff from each local. Now, I'd like to turn things over to Lily from Pinnacle Claims Management. Pinnacle is our trust fund third-party administrator. Lily will walk you through the ease of enrolling the process, our benefits, and how to apply. Take it away, Lily.
Awesome. Thank you so much. Good evening, everyone. Thank you, Lady. Thank you, Anna. That was great information. I want to welcome you, first of all, and thank you for the really hard work that you do and taking a moment to join us tonight to learn a little bit more about the union, how to become a member, and how to take advantage of the healthcare fund. There are so many great benefits, so I'm excited to tell you all about it. Let's go to the next slide. Right, we've made it easier than ever for you to enroll. So we'll walk through that. Okay. And before I get started in talking about all things healthcare fund, I want to go back to what Lady said just a little bit ago when we first got started. If you have questions about your cases or your card or your personal situation going on with the healthcare fund, we'd be more than happy to talk about that offline. You can reach out to our service center, reach out to us, after this webinar. That way we don't put anybody's information out there. We want to keep everything safe and private for you. So I just want to say that before we get started. But talking about the healthcare fund, we've made it easier than ever for you to apply and for you to take advantage of all these benefits that we have available for you as childcare providers. And again, my name is Lily. I know Horace gave a brief description, of who I am. Some familiar faces I see, some are new friends. So welcome everyone. But some of you I've seen at the in-person event. So I'll be happy to meet more of you as we go to these events. But my name is Lily. You'll see my name come up as Anna Lilia. I'll answer to both. If I'm in trouble, I know Anna Lilia. I'll sit up a little bit straighter. But Lily or Anna Lilia is fine. So thank you, everyone. But these benefits are available for our childcare providers, and they're completely free through the healthcare fund. The application process, we'll talk about that in just a second, but once you become active in the healthcare fund, you're going to get access to dental insurance, vision insurance, life insurance, voluntary life and basic life. We'll talk about what those two mean, and also mental health benefits. So let's talk a little bit about the application. So in order to apply, you can apply two different ways. It's very easy to apply. You can submit the application online. You see the information is here on this slide. I'll give you a second to jot it down. You can fill it out online, or you can also download the application from our website and you can submit it. If you have questions or get stuck, need help on filling it out, you can definitely get in contact with us either by giving us a call. The PRC number is listed. That's the Provider Resource Center, or also our website. The form is available there, the application, and you can email it or again mail it. If you prefer to mail it, the address is on the bottom of the actual application. All right. So what do we get after we submit our application to the healthcare fund? You're going to get access to so many things. This is a brand new one that came up. It's family benefits. So what does that mean? Your eligible dependents, so your spouse, your children, you can now give them access to these benefits. If you submit the application, there's an addendum. If you apply online, it's automatically they're now updated where you can add your dependents. If you fill out a paper application, we do have an addendum for you to be able to add your eligible dependents. And again, just like the application, you can send that in online or you can mail that in. So what will they get? They will get also access to all of these benefits. Once you add your dependents, they will also get free dental and vision, as you see here. They will get the provider assistance program, which we'll learn about a little bit down the presentation. They'll also be able to get access to the voluntary life insurance if you decide to purchase that. And we'll talk a little bit about all of those benefits and what they mean. Next slide. All right. So the reimbursement, this is huge. The reimbursement program gives you access to get help and be reimbursed for those out-of-pocket expenses. Now we know going to the doctor sometimes can be expensive. Medications, co-payments, co-insurance, all of these things. Part of the reimbursement program gives you that benefit to be reimbursed. Now, most importantly, I'll say this though, you definitely want to keep your receipt. And does that mean that if my eligible dependent goes to the doctor and their co-payments would be covered? Yes, absolutely. You want to submit those receipts for your eligible dependents as well. So let's go on to the next slide to talk a little bit more about the reimbursement. Thank you, Marcella. Next slide. So the reimbursement program, when we're talking about the reimbursement program, I mentioned a few things. So deductibles, doctor visits, the co-pays that we have, lab tests, medical equipment, or when you go pick up the prescription. This is not the healthcare fund. It's not an insurance. We work hand in hand with your insurance. And once you submit proof of coverage, which we'll talk a little bit about what proof of coverage actually means, but once you submit that proof of coverage under one of the qualifying healthcare plans, you get access to these reimbursement benefits. As a child care provider, you would get up to $9,450 for out-of-pocket expenses. Now, ladies and gentlemen, that is a pretty big amount. So they worked really hard to get this money available for you. Take advantage of that. It's free. You don't have to pay for this service at all. So let's talk about dependents. You'll see there the bigger number, 18,900. When you add your dependents, the eligible dependents, you can get up to the 18,900. And you want to take advantage of this money because if you don't use it, it does not roll over to the next year. So it does renew every year as long as you're active in the healthcare fund. That would renew year per year, calendar year. But whatever is not used throughout the year, then it does not roll over. So definitely take advantage of that. And then also, last but not least, your premiums. Now we know again, health insurance is expensive. So for the premiums, you can also get reimbursed for the premiums. Okay. You definitely want to send in the premium billing statement and request to be reimbursed for that. It's as simple as that. Let's go on to the next slide. All right. Now, when we're talking about the qualifying healthcare plans, right? You heard me mention that just a second ago. We have many different healthcare plans that fall into what would be considered a qualifying healthcare plan, which is all of these that you see listed. So, employer sponsored. What does that mean, right? Either through my job or through your spouse. That would be deemed as a qualifying healthcare plan. Covered California is what you see next. For Covered California, you would have to be enrolled in a silver HMO plan. Now, I'll tell you this, not always is a silver HMO plan available in your area. So then in that case, an EPO or PPO may be accepted, okay? Also, we see Medi-Cal, Medicare, Medicare Advantage, Veterans Affairs, and TRICARE. So these are all deemed as qualifying healthcare plans. You would just need to submit the proof of coverage, which we'll talk about in just a second. Next slide. All right. Now, proof of coverage, what should be on that proof of coverage? You definitely want to make sure that you have your name on the documents that you submit, right? We want to make sure that we know it's for you, the childcare provider, or if you're adding your dependents, you want to make sure that you have your dependent's name showing up on that. You want the effective date. We want to make sure that it's current, right? We need to verify because we work hand in hand with your insurance. So the effective date has to be there. The type of insurance plan, right? What type of health plan is it? And then last but not least, that premium. You definitely want to make sure if you have a premium, if you have a healthcare plan and you have a premium for that, submit that for reimbursement. So you want to submit those documents. That is what will be considered proof of coverage. Next slide, Marcella. All right, now let's talk about the other benefits. What else do we get? These are all free benefits. This next one that I'm going to talk about is dental. The dental, and you'll see both, they're kind of combined on this line, dental and vision, because both of them are brought to us by MetLife. So let's go ahead and move on to the next one. Now, dental benefits. Dental benefits, I don't know about you guys if you have been to the dentist lately, but it all begins with preventative care. You'll hear your dentist probably say that a lot. So what does that mean, right? Our cleanings, the x-rays that come when you go get your dental exams, even fillings and different things. So let's take a closer look at this dental benefit. All right. For in-network providers, for doctors, right, the dentists, no deductible, no annual maximum benefit. I was talking about preventative care. What does that mean? So you can see right there, you'll be able to get your cleanings and your exams 2 per calendar year, and then x-rays as well. So these are great benefits, again, that as childcare providers, you don't have to pay for that. This is given to you automatically when you sign up for the healthcare fund. This is available for you and your dependents. So let's talk about the next information here on the next slide. You heard me say vision. Vision is also administered and brought to us by MetLife. Again, this is at no cost to you. So for vision, I don't know about you guys, but where are my glasses? I recently got some glasses. You can see right here. You're able to get glasses, and they're pretty expensive. If you can see, you can go to Costco for those of us that have a Costco membership, or picking an optometrist that's nearby. MetLife can help you pick one. And I'll say the same thing. I know we moved down from dental, but you want to select a dentist. You certainly should select a dentist in order to take advantage of those benefits. If you don't know how, I'll get you the contact for MetLife after we're done, and that way they can help you select a dentist or an optometrist near you. But for vision, you're able to get your eye exams. Let's go to the next slide. That way we can talk a little bit about it in a closer look. So the eye exams, you're able to get your eye exams once every 12 months, right? I personally will share this with you. I put off getting my new glasses probably for a little bit over 2 years, maybe three, if I'm being honest, because they're costly. So with this benefit, you're able to get your glasses. If you add your dependents, they will also be able to get their eye exams and their glasses. You have for your frames up to $150 for allowance and no co-payments. Again, to get your eye exams and all of that, you're able to go, and as long as you select an optometrist. So please take advantage of these benefits. They are absolutely free. As long as you're in the healthcare fund and you're part of the fund, you'll have access to these. All right. Next, we have Provider Assistance Program. We've had a lot of requests for this program. What is Provider Assistance Program? You'll hear the acronym PAP. This is brought to us by Spring Health. This is for mental health. And for Spring Health, I'll let you know, I know that, life is a beautiful thing, but it can be very hard. And as childcare providers, you care for so many people, sometimes you put yourselves last, right? We take care of everybody else, and then we leave us in the back, right? Now, this provider assistance program is to help us out with those times when we need a professional, when we need to speak to someone about things that are happening, right? They're able to give you 6 free therapy sessions, or also not or, and you get 6 free therapy sessions, and you get 6 free coaching sessions with a licensed coach. These are professionals, and all of this is confidential. They will not share the information with us. They will not share the information with the union, with CCPU in general. Nobody will know. This is all confidential. You're able to either speak with a therapist in person. We can, Spring Health will help you find one that's close to you, that speaks your language. If you want to do it from the comfort of your own home because you guys are so busy, you can do that too. You can have meetings with these licensed professionals via Zoom if that's what you prefer. Now, what if I add my spouse because my spouse is my dependent? Your spouse will also get these benefits if they're added as an eligible dependent. Your children can also get these benefits. Everyone will have their own 6 free sessions. They'll get the 6 free therapy sessions and also the 6 free coaching sessions. And I'll let you know once you sign up, and you don't have to apply for this benefit, but once you create your profile with Spring Health, which I'll show you how to do that. But once you create that profile, they have so many different fun activities for you to take advantage of. They have things, for mental health awareness, for substance abuse, for, people that are dealing now with taking care of an older parent or marriage counseling. They have different classes and things online that you can take advantage of. So it's a great benefit, completely free. Next slide. All right, so we have basic life insurance. This one, and all of them are very important, but this gives peace of mind and the event that, heaven forbid, but we pass away. It will give your family peace of mind knowing that they're going to have some assistance when we're no longer here. This benefit, you do not have to apply for it automatically. Again, once you are part of the healthcare fund, this benefit is available for you and your family. All you have to do is fill out a beneficiary form so we know who is deemed as that beneficiary. So what is this benefit? In the event that we pass away, your whoever you deemed as that beneficiary would receive $50,000. And no questions asked. You are not going to be required to go through a medical exam or any physical examination. You don't have to pay for this service. This is available just because you are part of the healthcare fund. So all that we need from you, if you have not done so yet, please fill out a beneficiary form. It is available on our website under forms. Again, you can email it, you can mail it in, whatever is most convenient, but definitely leave that and submit it. That way we have that and put it in your file. Okay. Thank you. Next slide. Voluntary life. Okay. So I don't know about you guys, but what if, 50,000, that's beautiful. That's quite a lot, right? But what if, you're like, well, I have a mortgage. I have kids, right? I have other expenses. Our life situation looks different for all of us. So what about if you want to purchase additional coverage? This is the only benefit that you will have to pay for if you choose to obtain a voluntary life insurance policy. Now, for this voluntary life insurance policy, I'll tell you this, there is an open enrollment period. So if you are an existing childcare provider and you did not take advantage of this yet, that's okay. The open enrollment period did pass. Okay, it's from May 15th through June 30th, but May 15th will be here in the blink of an eye. So you will be able to take advantage and sign up for the voluntary life insurance if you did not do that this year. It'll open up again May 15th, 2026, and it'll run through June 30th, 2026. You will be able to sign up, and the application for that and the rates are on the website. Now, what if I'm a new childcare provider? I've never signed up. This is my very first time. Now, because those of you that have never signed up and you're submitting your application into the healthcare fund for the first time, you will have access to elect this benefit. Okay, you have a 30-day window to take advantage and sign up and say, yes, okay, I submit my application today and I'm going to think about it. I'm going to download the rates and see what's going on. And I'm going to decide, yes, I do want to purchase a policy for myself or for my spouse if I have them as a dependent. You will have 30 days to make that selection and submit your application for this voluntary life insurance. Now, I want to take a moment to talk about the coverages and different options. And there's a lot of rates and a lot of great information on our website, but I'll tell you this about the benefit. Providers, as a childcare provider, you are able to purchase up to $500,000 for the policy. Now, right next to that, in that slide, the very first bullet, you see in parentheses, it says guaranteed issue, 200,000. What does that mean? That means that you can purchase up to $200,000 of this life insurance policy with no questions asked. You're not going to be requested to do a physical or a medical exam of some sort, as long as it's within that guaranteed issue. If you want to purchase more, you certainly can. But then that means, and this benefit is brought to us by Guardian/Legacy. So that means that Guardian will reach out to you. And again, we won't know any of this information, but if you choose anything above that guaranteed issue, they're going to reach out to you and request a possible medical exam. And that information will be confidential, based on the information you provided them and the amount you selected. That might be something that they ask you for. But the guaranteed issue with no questions asked, as a childcare provider, you can purchase up to $200,000. Now, right below that, you see for your family, right? Coverage for your family. You're able to purchase it. If you purchase a policy for yourself, you're able to purchase a policy for your eligible dependents. For your spouse, you can get up to $250,000. The guaranteed issue for your spouse is $50,000. And then for your children, you're able to purchase a policy for up to $10,000. So again, if you purchase anything above that guaranteed issue, then that's, when a medical exam might be required, but anything below that does not require it. And I'll let you guys know, I don't know if any of you have recently looked into getting life insurance. I know a few years ago when I purchased my home, that's when I said, okay, I don't want to leave my family with this burden right after if I'm not here. And that's when I purchased life insurance. It is pricey, but CCPU, they worked out a great deal. So these rates are awesome. None like I've ever seen before. So you want to take advantage of this. The rates are all on our website, and we can show you how to get there once we're done with the webinar. But this is a great benefit. Okay. Thank you. Next slide. Now, how do I apply? How do I get all of this, Lily, that you're talking about, girl, right? How do I get this? Let's talk about that. Two things in order to be, deemed as eligible to sign up for this healthcare fund. All you have to do is work with a subsidized child, at least one, whether you have 1 or 10, working with a subsidized child, and have taken care of a subsidized child at least 3 out of the last 6 months. Okay, and that's it. That's it. You submit your application. Let's go to the next slide. And the application, again, you can submit it on our website. I'm going to pause here for a second And that way you can jot down where the website is. If you haven't applied yet, fill out that application, submit it. And you have the phone number there for PRC, that 888 phone number. If you get stuck, if you need help on filling it out, the PRC, the Provider Resource Center, that it's a great group. They'll be able to help you out if you give them a call and help you on how to fill it out. Or if you say, hey, Lily girl, I just want to mail it in, you definitely can download it. You can download that application off our website. And right on the bottom of that document, you'll see our mailing address and you can mail it in. Okay. Now, once you get that application submitted, you will get access to the benefits that I talked about automatically, the dental, the vision, PAP, that provider assistance program, you'll get access to that. And once, if you decide to submit the proof of insurance, then you'll get access to the reimbursement portion, which is great. That's a lot of money on the table for you. So take advantage of it. Okay. Thank you. Next slide. All right. All right. Now I said I was going to share the information on, how do I contact these folks? How do I get in contact with you guys? You'll see first the healthcare fund. You see the QR code. You see our website there. You have the PRC email and you have the PRC phone number. So please grab our voluntary life rates, our healthcare fund applications available. If you want to add dependents, that document is also available under forms. Now, what if I'm already enrolled in the program, right? And I haven't selected a dentist. I heard you say I need to select a dentist or I need to find an optometrist, right? I need to go get my glasses. That's through MetLife, Dental and Vision. You'll see the phone number there for them or the QR code as well. And then over at the top, you see Guardian/Legacy. That's for those two life insurance benefits. So the basic group term life insurance is that one that you automatically get once you're enrolled in the healthcare fund. The $50,000 in the event that you pass away, your beneficiary would get that. And also they take care of the voluntary life. So if you decide to purchase a voluntary life insurance policy, those would be the folks that can help you, with any questions. If you have specific questions for them, you have that contact information. And for that provider assistance program, PAP, brought to us through Spring Health, we see their phone number on the bottom of our screen. There's also a crisis support line, for emergencies when we are in need of that crisis. They do have regular, you see the phone number 833 phone number for questions to learn more about that, to find out how can I sign up with a therapist, or if you happen to need that crisis line, it is available there. So next slide. All right. Well, that brings us to the end of the presentation, but we definitely want to give you guys, I know we have about 10 minutes or so, a little bit over 10 minutes to answer questions. We'll try to answer as many as we can. Feel free to type them in the chat, the Q&A, if you are able to come off mute as well. If not, then the Q&A will be able to answer the questions that you have. So thank you so much for giving me an opportunity to share a little bit about the healthcare fund. Horace.
Lily, thank you very much for this breaking down the beautiful, smooth process of how this healthcare fund is running. I've seen some great questions in the chat as well as in the Q&A section, and we're going to get to those. And those we're not able to get to, we gave you those contact information on how to get a hold of us through the PRC, through the email, through the phone calls. Please reach out. But here's a few questions we're going to jump onto. I wanted to make sure everyone understands that we do not discriminate. We're here to provide healthcare coverage as long as you have a subsidy child. One subsidy child, that's all it needs for the duration of setting up your process. So you take care of subsidy voucher child, then you are have a healthcare fund. If you don't have a healthcare fund, then you're able to go ahead and talk to us, and we'll set you up with one of the brokers to align that for you to get healthcare to be able to take advantage of this. And it does not matter if you do not have a Social Security. Your status of your Social Security, if you don't have one, we're not discriminating. It does not report to anyone. you will still be able to apply and receive everything that everyone else is getting. But the key is you have to have a subsidy child. And if that's a problem, because that was a question in one of the chats, talk to your local organizers. They'll be able to help you, give you some insights, and some of the active providers in the area may be able to give a reference to you. We know there are some areas that are difficult, but other areas we got to stand together and chain together. So thank you.
All right, let's see some of these questions here. One of them says, I'm trying to scroll up. I never got a letter about the life insurance policy. So the open enrollment was from May 15th of this year through June 30th. We sent out the application. But don't worry, if you are already enrolled in the healthcare fund and you did not sign up or were able to enroll and purchase a voluntary life insurance policy, you will be able to do that during the next open enrollment period, and that'll be May 15th through June 30th. We'll start sending out notifications as well, reminding you guys and saying, hey, the open enrollment period is coming up for voluntary life, and you'll be able to submit that application at that time. For new applicants, for people who have never taken advantage of the healthcare fund and are applying for the first time, those are the folks that I was saying, you'll have that 30-day window to take advantage of this benefit. Okay. All right, I see another one. Currently, I don't have a subsidized child. Do I qualify? No, that is the requirement. So as soon as you do, please reach out to us because that is the requirement. You must work with a subsidized child and, have worked with a subsidized child 3 out of the last 6 months. Okay. All right, there's one in Spanish, and I'll read it both in English and Spanish. Hola, es mi primera vez con licencia para el daycare. Tengo un mes y califico para el beneficio. Hi, it's my first time obtaining a daycare license. I've only had it for a month, so I qualify. The answer is yes. La respuesta es sí. Si trabaja con un niño o niña de que sea subsidiario, puede entonces calificar. Tiene que ser 3 meses por lo menos trabajar con un niño subsidiado 3 meses de los últimos 6. So again, yes, you do qualify as long as you've worked with a subsidized child, even if you just opened the daycare, but if you've worked with a subsidized child for at least 3 out of the last 6 months.
I got one for us. Signed up for the voluntary, never got the information of a letter to how to pay for the additional life insurance. If you go onto the website and look at the benefits and you see the voluntary, in that area it says frequently questions, there's a section that says, how do I pay? There's a hyperlink to show you how to get connected and how to pay those payments so you can get caught up. So please make sure you go to the website, look at the benefits that we offer, click on voluntary, and then at voluntary, there's some questions and answers. Frequently you ask, how do I pay? You'll be to click on that hyperlink. Thank you.
Thank you, Horace. All right, what other questions? Trying to scroll to see which ones we have not answered. Okay. My spouse is paying for the premium for insurance. Can I still claim him as a dependent? Yes, you can definitely add your spouse, to add an eligible dependent. So if both you and your spouse are obviously on his employer plan, the insurance plan, submit that application for him. It's an addendum. So to add a dependent, that document is on our website. And you're able to just fill out the information, send us a copy of the insurance. That way we can verify. Remember, going back to that slide talking about proof of coverage that shows your names, that shows the deductible, or the premium billing statement. Yes, you definitely can add that. Now we will reimburse. As a childcare provider, you get reimbursed your portion 100% of that. Now for the added dependents, you want to look on our website because it also depends as far as the reimbursement, what would I get, and it all depends on the healthcare plan because every plan is a little bit different. But the answer for your question, Sabina, is yes, you can. Okay.
I have one for us. I'm a new childcare provider that just started back in August with a new child. Do I still have to wait until May of 2026? The answer is no, but that's a simple answer. The reality is there is a initial sign up time frame where in the last 6 months you have to have one subsidy child for 3 months. So August is 1 month. We need 2 more months locked in, but you should still free to sign up and then get that application to get started so we can get you in that pool. Once you have that subsidy child for one child for 3 months, then you would be able to confirm that you have health care. If you don't have health care, we can help you sign up for it. And then you do not have to wait. You have 30 days from the time that you are accepted into the healthcare fund to go ahead and take advantage of the voluntary. But all those other benefits are there for your taking. You do not have to wait till May of 2026. Thank you.
All right. There's another one on here. How long after applying for the healthcare fund do I have to wait to access these benefits? These benefits come on almost instantaneously. As long as you submit that, and I say this, the simple answer is yes, right away. But a little bit of a closer look to that response is, the benefits that we talked about, the provider assistance program, the voluntary life, dental and vision, those will come on right away. The reimbursement part of this, though, you definitely want to submit that proof of coverage in order to be reimbursed because we need to know what type of insurance do you have, right? What is the premium amount? So sending that premium billing statement then and getting reimbursed will just depend on that. But as far as all the other benefits, once you submit your application, we sign you up. Depending on, if the application comes in before the 15th of the month, then you'll get benefits right away. For after the 15th, then dental and vision will begin the next month. But so we can just say, as a matter of in 2 weeks, you'll start getting these benefits.
I got another one for us.
Yep.
So I'm not sure if I sent in my beneficiary form for basic life insurance. Should I just call Guardian? I'm going to say no because Guardian is such a huge company. We don't want your form and your information to be floating around. We have specific numbers that you can reach out to, either Pinnacle, reach it out to, or you can reach out to the PRC, or you can reach directly out to Legacy, who is the broker servicing rep for Guardian for our CCPU benefit fund. The second portion of that question was, I just lost it. Hold on a second. Do I have to be licensed childcare provider to apply for the benefits? No. This benefit is for licensed as well as non-licensed family, friends, and neighbors. We provide all that hard work, and this is your benefit to receive. So that hopefully that puts a smile on your face. Everyone's active as long as they take care of a subsidy child. Thank you.
Horace and Lily, there is a duplicate of the same question. It's about how old has to be my child to be part of this insurance.
Great question. The age for a dependent, to add them for the coverage as well as it's age of 26. So if they are going to school and they're under your beneficiary, they're a dependent from 0 to 26 is your dependent that could be added to this fund.
So I'm gonna do that in Spanish or no?
Sure.
Or probably there is a translation already. So that was for Alma and I believe Elba Borunda and Alma. Same question. Okay, thank you.
Right. Well, thank you so much. I know we are at time, but I hope you were able to get some great information out of this webinar. We're so happy that you took the time out of your busy schedule to join us, but I appreciate everyone for showing up, asking great questions, and following along. So I can't wait to hear from you and for you to submit the applications if you have not done so. Okay, thank you so much. I hope you have a great evening.
Hold on one second. Last thing. For those who didn't have their question answered, we have a chat and as well as a Q&A session. We have it recorded. We will follow up with those who need to get answered if we weren't able to answer those questions. Thank you guys for showing up. Have a great evening.
Good night, everyone.
Thank
Good
you.
night. Buenas
Good night.
noches.
Buenas noches.